Good morning, everyone. Welcome to Gaining Pre-Health Experiences. My name is Ann Palmer, and I'm just really excited to be here with you today. We do have the live option right now via YouTube. So if you have any questions as we go along, you can certainly throw those questions in the chat, and I will see those periodically and get back to them. You may also notice that I'm using a captioning system that's actually through PowerPoint. So hopefully that will help make this a little more accessible. It's not 100% accurate, but I think it's better than nothing. So anyway, without further ado, let's go ahead and jump in. So as I mentioned, my name is Ann Palmer, and I work at the KU Edwards campus. I am in career development, and I more specifically work with our post-bac in health sciences program, which is a cohort of around 20 to 25 students who have applied and gained admission into a one-year program to ultimately get ready and prepare and strengthen their application for some sort of graduate program. So whether that is in a pre-health field or medical school, there's a certain level of academic rigor that they're taking upper level science courses. And then there's also an element of professional development. And that's where I come in when we're talking about things like gaining experiences and the application process and interview prep and just really how to be the most competitive applicant that you possibly can be. So that's what I do. Obviously, I'm a bit of an animal lover here. I did make sure that the cats are upstairs because they're the ones that climb on me during presentations. So unfortunately for you, you won't get to see that little comic relief. The puppies are here behind me. Hopefully they will remain calm and quiet for our time today. And then my husband, Steve, that you can see down in the corner there, he is a nurse actually within the KU health system. And so, when we're not in a pandemic, we love traveling and exploring the country and the world, and we're definitely looking forward to getting back to that. So that's a little bit about me. What we're looking at today, gaining experiences, we know that for any pre-health student, just simply going to class and getting good grades is not enough. It's not enough to make you a holistically rounded, well-rounded applicant. And so we're going to talk about some of the aspects of outside of your GPA and outside of your MCAT or DAT or OAT scores, what that looks like, and clearly define what those different experiences are, because it can be a little bit confusing. And also talking more specifically about our virtual space right now. There are a lot of questions around virtual experiences. So we're gonna debunk some of those myths a little bit today, and then talk more specifically about various programs and their shadowing and volunteer hour requirements. And then I think one of the most important things about it is, why are you doing this? And how are you going to communicate those experiences in your application and in your essays and in your interview, so on and so forth. So that's what we're going to spend time doing today. As I mentioned, for those of you who are joining us live, please feel free to pop questions in the chat. I will stop periodically and have a look, and definitely save some space at the end for you to ask any questions that you have. All right, so let's kind of start here with these very general and generic applicant buckets that I like to refer to. And, we see up here at the top, we're talking about some nuts and bolts figures, right? cumulative GPA, your science GPA, and then also whatever your entrance exam score ends up being. So there's, that's very black and white in terms of numbers on the page, and, your transcripts and all of those wonderful things that you're preparing for academically. But then when we come down here in these bottom two buckets, this is kind of the meat and potatoes of what I work with students on. And, talking about both clinical and non-clinical experiences and how those are, first of all, how they're formative and how they are ultimately helping you decide what your career path is and why it's so important to you, but then also where you are going to reflect upon those experiences and how you're going to reflect upon those experiences through your personal statement, through your most meaningful experience essays, and certainly in letters of recommendation and how people are speaking of you, because that's where you're interacting and really having, hopefully, some really, really formative experiences. So let's kind of provide some clearer definitions of what this looks like. So when we're looking at paid opportunities, things that are more clinically based and more hands-on patient experience, we're going to look at things like you see over here, a phlebotomist, scribe, EMT. These are all things that typically require some sort of certification or extra training hours for you to gain before you can actually get a job in one of those areas. And they are typically, though, and when I say job, and I mean a paid experience job, it's a kind of a great way to double dip, right? For you to be able to actually work in a healthcare field and be getting paid for that is a fantastic experience. And then, we talk about clinical volunteering. What is that? Well, that can be a variety of things, but some of the more common ones that you'll find are hospice volunteers or volunteering in maybe a skilled nursing facility, community health clinics, especially right now. Now, let me say that in community health clinics right now, especially with COVID-19, there are a lot of extra volunteers needed for things like distributing meals, distributing lunches, helping with paperwork, data entry. There are a lot of things that fall within that scope that even though you're getting those experiences and those volunteer experiences, you may not actually be hands-on, so to speak, with a patient, but it's patient-centered and patient-focused, if that makes sense. And then certainly, a lot of students utilize starting as a hospital volunteer to then work into opportunities for shadowing. And I should pause and say that is by far, when people ask about gaining shadowing experiences, even when we're not in the middle of a pandemic, the best way to gain shadowing experiences is through your volunteer opportunities, right? Especially if you're working or volunteering in a hospital or any sort of clinic or area where you're interacting with various healthcare professionals. It's the prime time to step up and say, I would really love to learn more about what you do. Would it be possible for me to shadow you sometime? It's absolutely appropriate, and it's absolutely when you step into those opportunities and ask. And then, as we're talking about shadowing right now, yes, there are some organizations that are allowing in-person shadowing right now. It is largely not happening for the most part. And so a whole new bumper crop of virtual shadowing opportunities have been created. And we're going to talk about those, and I'm going to share some websites with you in a little bit. But know that those are available, and yes, you should be seeking them out. The more formalized structure, if you're looking for something that is maybe a summer long, or that has more of almost an internship kind of feel to it, is through hospital observership programs. And the main hospitals, particularly here in the Kansas City area, they almost all have some form of that. Again, most of them are not doing the in-person experiences right now, but that doesn't mean that you shouldn't be checking to see when those are going to be starting back up, because getting an application in early and kind of getting in line for those opportunities will be an important step. And then there's the KU mentoring platform. If you haven't already checked into that through the Alumni Association, this is a perfect opportunity to be paired with a KU alumni who is in healthcare, working in healthcare right now, and start that conversation and start building your network to gain those shadowing or other opportunities, or just having someone to help you navigate these processes. It's a great thing to do. So I encourage you to check into that if you haven't already. Okay, so direct patient care experience. This gets murky. As I explained just a minute ago, you may be working in a clinic or working in a hospital, or I should say volunteering, and you are not having your hands directly on patients, but you are still working in that area. And I think that is volunteering, okay? And that is clinical types of volunteering. But when we're talking about direct patient care experiences, this is really important, especially for students who are wanting to become physician assistants. They require a lot more direct patient care experiences, which typically means you're going to need to get that CNA certification, or phlebotomist or medical scribe is oftentimes an option, but especially the PA programs really want to see that hands-on care, and they want to see anywhere from 500 or 1,000 hours. So really pay attention to whatever program that you are applying for. Not only does this vary between profession to profession, it also can really vary between program to program. And by program, I mean whether you're looking at Creighton or KU or Tufts or Medical College of Georgia, right? They have different requirements. So really getting familiar with those websites and the admissions requirements, particularly as it pertains to experiences, is a really important thing to do. So what are some examples of non-clinical volunteering? Let me first say that they are just as important and can be just as impactful as actual clinical shadowing hours, clinical volunteering hours. And admissions committees love to see them, okay? So there are a lot of opportunities right now for, especially through harvesters, food banks, or helping serve community meals. There are a lot of opportunities through churches. I've seen a lot of people that volunteer and do a lot of Sunday school teaching, but there are also a lot of outreach ministries that are happening through churches that are wonderful opportunities to be involved with. Habitat for Humanity is another big one, or a place like Sleepyhead Beds, that is an organization that helps people that don't have beds, mattresses, actually get them. And so again, it doesn't have to just be a clinical volunteering setting. You're getting a lot of interaction and getting really, really keen insight on patients' lives and experiences by volunteering in some of these other settings. And they're just as important to do. So I mentioned before virtual shadowing, and there have been a lot of questions, and certainly over the last year, I think we've just had to figure out virtual spaces in a much different way than we knew of a year ago. And so I listed several of the virtual shadowing websites that are available now. And these are ones that I either have current students that have experienced some of these and have had good experiences, it's not the same as in-person shadowing. Of course it's not. But I think the biggest thing to remember is that admissions committees want to see that you're still working on it. You're still trying, you're still moving forward, right? It's that forward momentum and that upward trajectory that you're continuing to work on these things. They know it's hard. They know that you can't gain all of these experiences in person right now, but they want to see that you're still trying and that you're still putting yourself out there to learn. That's the biggest thing. So yes, absolutely look into these virtual shadowing options. And then also, take a tour of some of the virtual open houses that are happening. These are, I listed the one here that's happening at the KU School of Medicine, because not only are you hearing directly from admissions committees and faculty who are in those programs, but you're typically hearing from admissions directors or even deans that are really going to kind of break down what competitive applicants look like for their program and be available to answer your specific questions. So why not take advantage of that, right? You're not having to drive anywhere. You're not having to find parking anywhere. And they're really valuable. So take advantage of those experiences to really understand what you're looking at and what you're getting yourself into. There are also some really fantastic opportunities on campus, certainly through student organizations. Rock Chalk Central, if you haven't found it yet, is actually the website where you're going to find all of the student organizations that are listed. It can be a little clunky to get in there and search, but you can search through type, for example, occupational therapy or physical therapy or clinical lab sciences or medicine, and it will bring up a list of student organizations. You can actually also, if you know the name of the organization that you're interested in getting involved with, you can type that in and it will provide you with information on how to connect with that particular organization. There are also, when travel is allowed again, there's some really fantastic study abroad opportunities that you should check in with the study abroad office on campus, because there's a whole crew of people there who are waiting to work with you and who organize these pre-health, pre-med shadowing experiences abroad. And there are some scholarships available, and it's a really unique experience. So if that's something that you're interested in, definitely reach out to the study abroad office and they can help you start navigating that. And then there are just so many opportunities on campus to work as a tutor or volunteer as a tutor. If you have work study, if you're eligible for work study, you can actually get paid for doing a lot of these things. And pre-health ambassadors is another wonderful group. And certainly a lot of people choose to get involved with leadership opportunities through their Greek life and Greek organizations. It's another great way to show some leadership skills and get involved on campus. Ultimately, this is about your experiences and what makes you you. It can be through organizations or projects, through part-time jobs. If you've been a server or something that, there are just all kinds of things that you can learn from and show dedication and show work and show wonderful things and wonderful qualities about yourself. So think about what those are and really keep track of them, because starting early in your undergrad career and doing, first of all, keeping track of these things and not having to try to throw it together all at the end is huge. But also in terms of your volunteering and shadowing, getting 5 hours a week in beginning, your freshman or sophomore year, 5 hours a week for a couple of years really adds up, rather than all of a sudden trying to squeeze in, 100 hours of shadowing within a semester can be a little bit stressful. So think ahead, think about how you're going to balance these things out, um, and just do a little bit at a time, because also they want to see that you have been doing these types of things for a long period of time. They would much rather see 5 hours a week over 3 years than 25 hours in a month, because what that looks like is that you're just trying to check some boxes really quick at the end. So we'll talk a little bit more about that. I'm getting ahead of myself, but think about all of these things that make you you. So yes, I definitely feel the time crunch. I definitely feel for students, you have so much going on in your lives, and how in the world are you supposed to make time for all of this? Well, I think one of the biggest things that you can do is plan ahead. Think in terms of, yes, chunking this out a little bit at a time, like I mentioned, but also think about when you have some larger chunks of time where you can do something over the summer. Maybe you're going to be home where you have a greater network of friends and family to tap into that can help you gain some of these experiences. Maybe there's some sort of intensive that's happening over the winter break, or you get my drift here. Think ahead and be thinking about getting some opportunities scheduled when you're in a place where, number one, you have a much greater flexibility in your schedule and you can take these hours as they come, but also that you may be in closer proximity to your home network of people that can really help you put some of these things together, and don't be afraid to use them. This is one example of a summer-long program. And this is, I put the website here. This is closed, and the applications close in March for this. So, we're past that deadline. But certainly if you are a freshman or sophomore standing and you have a minimum 2.5 GPA, you can work with a vast number. There are, I think I have in my notes here, 12 universities across the nation, each have a summer development program where you gain just really, really incredible experiences, and it's free. They put you up, you get to travel a little bit, go someplace else, experience all of these fantastic opportunities. And wow, I mean, how great. It is running all virtually right now, and I'm not sure what they've decided for 2022, but this is definitely one to keep on your radar and check back if you are thinking about applying for next year. Another great place to keep in your browser favorites is the NAHP, which is actually an advisors for health professions website, but they have an entire section dedicated to summer opportunities. They have research opportunities. They have specific programs. They have study abroad options. They have just a huge, vast, diverse kind of pot of things to choose from. So definitely keep that on your radar, in addition to hearing things through campus and your student organizations and Hire Jayhawks and all of those fantastic places as well. So the big question, how many hours do I need? Well, it depends. Don't you love all of these gray answers that we give you all the time? But it really does depend. First of all, it depends on wanting to be a physician assistant, for example. We're looking at a lot different package than we are for, say, nursing, and especially someone that's doing a Bachelor of Nursing 2+2 program where, you're admissions committee understands that you're applying for nursing school your sophomore year, and you haven't had a great deal of time to gain a vast number of experiences. Health profession you're talking to, what individual program you're talking about, and so on and so forth. But I did want to give you a little bit of just a bit of an idea. Now, don't take this as, set in stone, but just to give you an idea of some of the different health professions and what is expected. Another if you are on the pre-dentistry track, they really want a much higher level of shadowing. They want to see you in 5 different dental offices with a minimum of 100 hours of shadowing. They really, really want to see that you've had that direct patient experience, not only shadowing, but if you've gone that extra mile and are actually able to work in a dentist's office, that's even better. Pre-medicine, for example, this is where we talk about, if you can think about having 4 or 5 hours per week for a year, that adds up really quickly. Medicine, we also really want to make sure that for your shadowing, that you're not just doing specialties, that you make sure that you are getting experiences in either family medicine, primary care, internal medicine. It's very, very important that students, even though you may in your mind have a goal of being a cardiothoracic surgeon, great, fantastic. You had an amazing experience shadowing a cardiothoracic surgeon, but admissions committees they tend to frown on that a bit when you come into an application or an interview saying you already have your mind made up before you've even been admitted into their program. Okay. So keep an open mind. The whole idea is to shadow people with different focuses so that you can get a broader understanding of the healthcare team, number one, but then that you yourself can figure out what works, what doesn't work for you, and where you feel that your strengths lie. And again, I mentioned the physician assistant, and, then we talk about vet school. Some of the descriptions that you'll see on their program pages are pretty vague. And it doesn't give you a specific number of hours. I would say, just generally speaking, all programs want to see that you've had some exposure so that you really have a sense of, what a day in the life looks like. And if this really is, this is a huge investment of your time and energy and money and really lifelong learning for these professions. They want to make sure that it's a good fit. So, right. Why? Why? Other than looking good on an application, why do we have to do this? Great question. So, okay. So what we're looking at here is just a really fantastic visual of what a competitive applicant looks like. Now, this was created more specifically for pre-med students, but I think that you can easily transfer all of this information into any pre-health pathway, honestly. So again, we're looking at, obviously, we have the nuts and bolts of the GPA and the entrance exam scores. But look at that. That's one little corner. That's one little corner of what we're doing here. But then we go into all of these other skills that are going to be reflected through your personal statement. They're going to be written about in your most meaningful essays. You're going to be talking about them in interviews. And it's a big chunk. It just is a big chunk. So let me now show you this next slide without it being too overwhelming, because I think there are a lot of things happening. I'll give you a few moments to take this all in. But so what you're seeing here is this slide updated with the KU School of Medicine's their stats, their application stats for this last cycle. And you can certainly see, how many applications they received, how the interviews broke down. They always have a total of 211 seats in their program. 186 in-state is what they accepted, and 25 out of state. So yes, you probably are all very aware that the KU School of Medicine definitely, at the core of their mission is to serve rural communities and serve communities in Kansas. And so part of that, I think, is having students with Kansas ties in their programs. Anyway, I think also looking about, what are transferable skills? They're looking for how you manage your time, how you manage stress, and how you prioritize work. I think I mentioned, either in this take or the last take, that the amount of information that's coming to you in medical school is like, drinking from a fire hose. And so they want to see how you adapt and how you manage stress and how you balance everything. And certainly, are you an ethical person? Are you a person that patients want to place their trust in? How are you showing that? You're demonstrating that through your experiences and through all of these opportunities that you have leading up to actually applying for that program. Pretty important stuff. So to kind of give you a summary of what we were just talking about. Again, it's a lot of information. And so let's kind of look at it in, if you only take a few things away from what I've said. No matter how you choose to gain experiences, whether they're clinical volunteering, non-clinical volunteering, hands-on direct patient care experience, it's so much more important to have a quality experience than a bunch of little checking the boxes experiences, right? So by that, I mean, if you have that 4 or 5 hours of volunteering a week over 3 years, that shows dedication. That shows that you are taking the time to really serve people in that space. You're really getting a chance to know how that organization works. You're really interacting with other members of the team and showing that service through longevity. Okay. And I think that, thinking in terms of, when I see students that have a day of service, for example, those are wonderful. They're wonderful experiences. But if you have an 8-hour day of experience, and that's all you have 8 hours, say, for an entire semester, that doesn't look so great. Okay. You want to be building these experiences over a long period of time, because that's really truly when you can be of service. If you've only done it for 8 hours or had a couple of shifts, you're just getting through training, right? You haven't really even gotten into the meat and potatoes of everything. So how do you do this? Well, remember that if you're gaining these experiences for an entire 3 years, you start your freshman year and you're going to start actually writing about them in an application, maybe your junior year, the details are going to get a little bit fuzzy. Okay. You're going to do yourself a huge service by journaling, even if it's just very informal bullet point things to remember. You certainly want to journal about impactful experiences, meaningful experiences, obstacles that you have overcome, really formative interactions that you had or observed or witnessed, or, after you've had a shift, thinking about reflecting on that time and what you learned from it. But I think, thinking in terms of the competencies that you have learned and the distance that you've traveled is really, really an important thing to do. By competencies, if you have not yet discovered the AAMC core competencies, again, these were created for medical students. However, they are used across health professions and pre-health programs. And as you read them, I know it's pretty tiny here on the screen, but you can look on the AAMC website and read more specifically about them. I find it very interesting that, at the very top, we're talking about, service, social skills, cultural competence, teamwork, oral communication, certainly written communication, resilience and adaptability. All the way down here, we have 2 science competencies. 2. That's not nearly as much as one would expect. That certainly threw me off a little bit when I first started thinking about competencies for medical school. I think I can't stress enough how much they're looking at this broader picture of who you are and how you serve. It's just huge, and critical thinking, especially. That's what you do. Yeah. So I'll stop there. But if you want to look into the AAMC core competencies more in depth, there's this great little handy dandy guide that you can download for free on AAMC. It's called Anatomy of an Applicant. And it goes through and explains all of the different kinds of, or actually all of the different parts of the kind of the application process and what they mean, like what's the purpose behind them, rather than just something you have to do, right? But then it goes through and it has individual worksheets for the competencies. Each competency is listed out, and it gives you kind of an opportunity to reflect and think about, okay, where am I going to show this competency? How am I going to show this competency? Now, let me also say that programs do not expect you to have all of the competencies down pat and have, perfect examples to show of each of them. But I think it's a great way to keep yourself grounded in the greater purpose of this and really understand why you're doing this in the first place. So that's a handy tool that you can find on aamc.org, the Anatomy of an Applicant. I will always take an opportunity to remind you that your professionalism as a student is, well, it's already happening. It should already be happening right now. Everything that you're doing right now as an undergraduate student in a pre-health program is shaping what's next. And doing things like being in communication with your current professors or employers, building those relationships. At some point, it's going to be time to ask for a letter of recommendation. And I can't tell you how many times I've had students say, I haven't really gone to office hours. I haven't really had any, meaningful interactions with faculty. Well, you're going to have to put in a little bit of an effort to do that, because they are going to be future references and other students that you are going to be standing alongside in student organizations. Those are going to be professionals in your field. You may be working next to them one day. So building those relationships now, understand how other people perceive you. Think about building those habits, and networking doesn't have to be a formal thing. It's really about developing relationships. It can happen anytime or anywhere. And I've listed some places that it does typically happen, right? My favorite, of course, being at Chipotle, but this is just talking to people, whether that's online, whether that's in person, whether that's a part of a group or an organization in class. It's just all the time. And so I really encourage you to think about networking not as a formal suit and tie always happening at some sort of career fair, which those are great too. And I'm going to talk about that in a second, but it happens all the time. And it really is about just how you are building relationships in now and in the future. So speaking of career events, this is Health Careers Expo week, which again, super excited about this. Um, we have already had a pre-health resources presentation yesterday that is already available through the website that you can view. This this spliced version of this live and recorded presentation will also be available through that website. But then, we also have coming up on the 7th is actually the big expo. And there are, I think, like 54 employers and organizations. So that'll be grad schools and employment opportunities within the healthcare field in a virtual setting. So fantastic. But then we also have some other kind of educational components of the Writing Center will be hosting a presentation on personal statements. I will also be back with a post-bac student panel that I would really encourage you to attend. They are going to be talking about their unique experiences. One is currently a nurse, one is currently a physical therapist, one is currently a rehab tech, and they are all transitioning their careers and applying for medical school. One actually has already gained acceptance into KU's School of Medicine. So talk about unique experiences and their pathway and how the post-bac has really helped them with that. I would encourage you to attend that Thursday at 3. And then there's another great one on Friday, wrapping things up at 1 p.m., talking about alternative pathways. And it isn't always, career is very rarely a straight line, and there are alternatives and things to think about. So we'll dig into that more specifically there. So definitely, if you can't make the live presentation, check back on the recordings. We'll all be there for you through the website. So I would ask for questions now, but we're not live anymore. So I'll just say thank you. It's always fun to talk about how to gain experiences. I believe in it wholeheartedly in your career pathway, and I hope you won't hesitate to reach out to the Career Center with any questions that you have. And if you also have questions about the post-bac experiences, we'll be talking more about that on Thursday. You can reach out to me directly more about that as well. So thank you very much. Take care. Have a wonderful week.